Today, we are here to talk to Dr. Ramanuj Sinha, an ENT surgeon at ILS Hospital, Saltlake, Kolkata. He will help us with some informations and measures in how to tackle air and noise pollution.
It consists of particles, small, very small, medium, large. The large particles which are suspended in the environment, we can't inhale that. It is not possible for us to inhale that. But there are small particles which we inhale. The smaller particles, to some extent large, that deposits within the nasal mucosa. Very small particles, they go to our respiratory tract. And these are producing some allergic reactions, which consist of allergic rhinitis, sneezing, rhinorrhea, and goes after the COPD and asthma. We can prevent this by preventing inhalation of this kind of air, which is not possible. It is not possible for us to wear the masks every time. We can do, it is the government, it is the people. Awareness of the people is much more important.
Thank you so much. My next question is...
And it is not possible for us to avoid all sorts of dust and allergens. At least we can identify the particular allergen on which the person is susceptible. These allergens we can pick, such as a person who is susceptible to egg protein, a person who is susceptible to prawn. We can avoid these sorts of things. Thereby we can minimize to some extent. But dust particle, it is very difficult for a person to avoid.
Thank you so much. My next question is...
In nose bleeding, there are two types. We divide it in two categories. One is a person who is very small enough, below the age of 6 years, 7 years, 8 years. Nose picking is the most common. Nose picking is the most common. But particularly in adult, there are many causes. One most common thing is hypertension. Hypertension is not only the one thing. We are taking now the clopidogrel in old age. Person who is having cardiovascular disease. We are antiplatelet agents we are taking. These are also one of the cause for nose bleeding, profuse nose bleeding.
Thank you so much, sir. My last question is...
Pollution, noise pollution is of two types. One is continuous noise, one is sudden loud noise. Continuous noise, if we expose our ears, that is decibel, 80 decibel, more than 80 decibel. Decibel is the intensity, unit of intensity. And frequency is our frequency, such as from the frequency we can identify who am I speaking. It is a particular frequency, particularly tone. Now, if we go beyond more than 80 decibel, more than 90 decibel, 8 hours in a day for consecutive 5 days or more than 5 days in a week, there will be invariably the inner ear will going. There are hair cells, different hair cells for different frequency. This will undergo degeneration. An acoustic accident, it occurs when there is a loud sounds near your ear. It may produce some mechanical trauma also. There may be rupture of the tympanic membrane.
According to what Dr. Sinha said, avoidance and awareness is the best measure forward in tackling pollutions in today's times. With that, this is Konkona Singh signing off. Keep watching Parivesh News with environment for environment.